calamities like the Taal volcano eruption can really take a toll on one's health, especially for babies. What can be done to protect them from getting harmful diseases? Well, to tell us more about this, we're now joined by Dr. Ong-Lim. She's the president of the Pediatric Infectious Disease Society of the Philippines. Good morning, Doc. Thanks for being with us this morning.
Good morning.
All right. Now, whenever there are calamities, people either by choice or by force are brought to evacuation centers. What are the health risks involved in staying in evacuation centers, especially for kids and babies?
Okay. So unfortunately, because of this calamity, we've been forced to bring people together. And there's such a thing as risks associated with mass gatherings. And so one of the more important things to worry about actually are the risks of infectious diseases spreading in such a small environment where various transmissible diseases can be easily transferred from one person to another. So for those situations, usually the health authorities are very mindful about the risks of vaccine-preventable diseases, and they try to be on the lookout for those so that they can immediately isolate people who might have those kinds of illnesses.
All right. Now, given the situation, and especially the fact that we don't know how residents of Batangas and Cavite, how long they will have to stay in evacuation centers, how can these issues be addressed first on a personal level for families that are in the evacuation centers, and then on the local government level?
Okay. So I'm sure they've already put a lot of measures in place to protect both against these infectious diseases as well as environmental hazards. So I know we really had this run on masks in the local drugstores, and it's very important actually to be protected from dust and smoke, especially in those areas where heavy ashfall was experienced. So for those families in the evacuation centers, the immediate hazard is to make sure that the air quality that they're experiencing is acceptable. So if there's heavy ashfall, please do wear your masks. And then if you're in an area where there are lots of kids, lots of people, you try to be as healthy as you can be so that you don't catch the illnesses that they might have and you don't transmit if you are sick already.
All right. How can we best protect babies and young children from the effects of the ash fall? I mean, obviously, there's the idea of wearing masks, but in the absence of a mask or a mask that fits properly on a very small face, what do we do?
Okay, so one of the initial things that was mentioned in the advisories was to just stay indoors because that's really where you can control the air quality. So for people who don't have to be out, especially young children, they don't really have to be out of the house. Maybe keeping them at home might be a better idea for the meantime. And then if they do need to go out and the air quality in the area is bad, then do wear the mask. I have read some reports where they say that air quality in the Metro Manila area is not really very much affected. So there's also this temptation not to be too paranoid maybe about the need for protection. So it really does need a lot of judgment.
All right. Now let's talk about something else. There were health outbreaks last year. Of course, there was polio and measles. Are these diseases that are also at risk of spreading quickly within evacuation centers if sanitation isn't?
Oh yes, no, that's actually a very important point that you're bringing up. Siguro between measles and polio, I would really be more afraid about measles because the transmission is really fast. Polio is also something important, but because it's oral fecal transmission, so you just need to make sure that the water and food quality that the people are consuming are more controlled. So that's at least a little bit more easier to handle. Now for polio and measles, the immediate risk is actually to make sure that you identify people who are sick so that you can take them away from that environment.
Right, isolate them as soon as possible.
Correct.
Doc, if a child has inhaled a lot of ashfall, right, or air that contains ashfall, and they are having difficulty breathing, what's the treatment for that? What do we do with them?
Okay, so in those cases, they're likely to probably have already a pre-existing asthma or might be asthmatic and not yet diagnosed. So the immediate thing to do is to actually help them to breathe easier. And usually that requires medication. So for those asthmatics who are already established asthmatics, they need to make sure that they always have their medication with them so that they can use their rescue medications if needed.
All right. Would there be long-term effects of inhaling this ashfall?
Well, for people who already have chronic lung disease, this is something that they want to avoid definitely because it will increase the damage that they already are experiencing.
All right. Another thing we know, of course, that eyes are also very sensitive to
Yes.
ashfall. If a person is experiencing sensitivity, pain, or something unusual in their eyes because of the ashfall, what should they do?
Okay, so that one really does require professional attention. Kasi the only reason why your eye would probably experience tearing or pain is because there's some particle that might be lodged inside the eye. So aside from immediate first aid measures like washing it out with clear running water, if that doesn't help, then professional attention is necessary.
Okay, so go to a doctor.
Yes, please.
All right. Thank you so much for your time this morning. We do
Thank you.
appreciate it. Dr. Ong-Lim, President of the Pediatric Infectious Disease Society of the Philippines.